Good evening and welcome to News 9. I'm Bansi. Doctors wear the white coats with pride. It's a badge of honor for the doctors. But now a study claims that the long-sleeved coats actually worsen the situation for the patients. Yes, the study says banning doctors and medical students from wearing long-sleeved white coats could help reduce the spread of infections in the hospitals. Although long-sleeved white coats have traditionally been worn by doctors since the 19th century, the study claims white coats harbor potential contaminants and contribute considerably to the burden of the disease acquired in hospitals by spreading infection. Well, what does a white coat mean? Doctors say it is a symbol of being a doctor. Most of them identify doctors through their apparel of this white exterior that they wear, this white jacket, this white coat. But this doctor, who is from Mangalore, says it is not necessary. It is, on the other hand, detrimental to the patients. He says that UK has banned it already. India should ban it now. Now, to talk about this, we have a large panel of doctors. First, we have Dr. Banu. You're also from the same point of view. You also feel that white coats should be banned, and you will be speaking about it. We have Dr. Neeraj Patil, who is a former mayor of Lambeth, who is also a super specialist. And we have Dr. Savio, who is one of the administrators at St. John's. We have Dr. Reena Sunil, who manages her own hospital. And we have the man who started it all, Dr. Fernandes, who is joining us from Mangalore. Welcome, Dr. Fernandes, and please tell us why this.
Thank you very much.
Why this sudden? Why are you raising this issue of white coats? This is almost like stabbing the medical community in the back.
Well, I had written about the white coat 3 years ago, when I had first observed the medical students and residents roaming around the streets.
Okay.
And then it motivated me to take up the issue on a larger scale, because in the end, when patients are the sufferers, can we do something to reduce this disease burden? And hospital-acquired infections contribute in a big way for the disease process at large.
Okay, so in other words, you're saying the white coat is actually a problem.
Yes, I mean, this is a scientific review, so let us be very clear about that. And the references quoted show very strong evidences that white coat spreads nosocomial infections.
Can you be more specific, doctor? What kinds of infections are you talking about?
There's been study in Nigeria, there's been hospital-acquired infections, and the main bacteria is Staphylococcus aureus.
Okay. Okay, so what in other words you're saying is, if you remove the white coats, these infections could stop?
I don't say these infections would stop. It would significantly reduce the problem that is already existing. So let this not be a ticking time bomb that is waiting to explode, and when it will explode is anybody's guess.
Also, United Kingdom has banned white coats. Is this the reason why they've done it?
Yes, of course. In 2007, it was a landmark decision by the UK, and they've made it bare below the elbows, something which the Indian government can act upon and consider immediately. US also in 2009 had a similar proposition, but then of course the egos of doctors did not permit to have that.
Okay, let's find out the opinion of our esteemed panelists. First, let's ask Dr. Banu. You support Dr. Fernandes in this. What is your opinion?
I don't recommend banning aprons or white coats. I would say restrict the use of white coats. Restrict them to
Don't
the
ban
workplace.
it, just restrict it.
Yeah, restrict it to the workplace when you're taking care of the patients, and not roam around.
Don't wear it as a status symbol outside
Yes,
the hospital.
it's just a protective thing that you use inside the hospital, just as a barrier. I don't want you to use it in outside the hospital setting, going around to the canteens, the cafeterias, the libraries. I think that should be restricted.
Okay. So wear it discerningly.
Yes.
Okay, Dr. Patil, you are from UK. Now UK has banned white coats quite many years ago. So what do you wear in UK?
Well, let me tell you, prior to 2007, what happened was there was a big increase in hospital-related infections, and especially with two bugs.
Okay.
First one was the methicillin-resistant Staphylococcus aureus,
Okay.
and the Clostridium difficile. There was a high incidence of C. difficile and MRSA infections. So the study showed that there were three sources of this infection. One is lack of cleanliness within the hospital itself, like the floors, and second thing is the instruments, and the third thing is the treating doctor himself. Now the treating doctor, what happens is the MRSA, what we call it as methicillin resistant Staphylococcus aureus, it is in the skin of and the nostrils. Now the thing is, most of the doctors carry them as well. The problem comes is, now if you come in contact with a post-operative patient, now you infect that wound will not heal for 6 or 7 months. Normally a wound should heal within 2 weeks, but this will not heal for 6 or 7 months. And now the way this bug is transmitted is, one of the sources is the clothing of the doctor. Let it be a white cloth, blue cloth, whatever it is. Now the thing is, that is exactly the reason, fine, in United Kingdom you're not supposed to wear watches. Doctors and nurses are not supposed to wear watches.
Wristwatches.
Absolutely banned.
Okay.
Because you may contaminate. So if somebody is having carrying MRSA on their skin, while examining them, you catch that bug on your watch, and you see another patient, you are transmitting it. You're not supposed to wear any ornaments at all, except the only exception was the wedding ring for females.
Okay.
And the third thing is, you're not supposed to wear suits, full suits. You got to, if at all you want to wear anything, it should be half sleeve or just below the elbow.
Till the elbow.
So by doing this vigorous, by imposing this vigorous code, the incidence of hospital infections came down. I completely agree with Dr. Fernandes. The thing is, in India also there is the incidence of MRSA has gone up, the incidence of C. difficile has gone up, and the only way we can combat is by trying to improve the hygiene among doctors. And this is banning white coat is, why we are banning white coat is not because it's white in color, it's because of the length. It's the sleeve length that is the problem. No problem if a white coat is worn exclusively in the hospital, and if it's above the elbow, no problem.
No problem. There's no restriction on that.
Exactly. The problem is, you wear this white coat and you wash it, say once or twice a month, and you are carrying a lot of bugs on that, and you are contaminating patient wounds with an MRSA. And remember, the big problem is the MRSA. If your wound gets infected with MRSA, it will take at least 6 months to heal. That's very important.
Okay. Very incidentally, none of you are wearing white coats here, so
We would never do that.
Dr. Savio, you are one of the administrators at St. John's, where most of the doctors wear white coats. So does this restriction apply to you, or do you support this restriction?
No, I think it's the what we are discussed is maybe a little bit of overdoing the issue. The issue is that there has to be an awareness in the hospital of hospital infection control committees. So we need to, most of the hospitals may not have committees to check whether there is, how to control the infection within the hospital. So the solution.
Do you have one at St. John's?
Yes, we have.
It's
Most
called
of the
Hospital Infection Control
Committee. So the infectious diseases is becoming a very important field. Before that, we had specialties only in internal medicine.
Okay.
Now you have MDs in infectious diseases also who focus on these areas. Now,
have you had any such incidents which occurred? Has it come to your notice?
Yeah, no, the issue here is basically it's about hygiene. To cut the story short.
Doctors have to wash their hands more often.
Yeah,
doctors have to be careful about what they wear.
Standard protocols have to be followed. So, and there has to be, in between patients, the doctors have to do appropriate hand washing, and the size of the white coat has to be half-sleeved.
So you fully agree with this restriction? It should come into play?
No, with the modification, there has to be a change whereby half sleeves, and the hospital should take the responsibility of washing the lab coats.
Have you at St. John's had any incidents of this, whatever Dr. Neeraj Patel mentioned and the other problems? Have you had such a problem?
MRSA.
No, those will be there, those can be there, but
it can be there
It
anywhere?
can be there, but not specifically related with the white coat which you are mentioning in this.
It's hard to pinpoint and say it is this white coat that has caused this.
No, hospital-acquired infection is quite common.
It's common?
It's common because.
What is the incidence in our city or in India?
I don't have those statistics.
Very difficult to point out,
Very
but
difficult.
around 8 to 10%.
8 to 10%. Dr. Reena, you run a facility yourself. How do you ensure, do you wear a white coat?
No, I don't wear a white coat, first of all, because I'm a pediatrician.
Okay.
So generally, in principle, most of us pediatricians don't wear because the kids get frightened about it. But then coming to this
They get
point,
scared of white coats?
Yeah, they are. They are afraid of the word doctor. I mean, you start from a newborn, and then, especially around the age of, let's say, 1.5 to 4 years before they can really understand and you can speak to them, they get very, very petrified. So it's easier when you're casual and they just don't have the fear that you're a doctor, so we generally play around. The other part of it is I would also suggest restrictive use of it, because officially when these aprons were started, they were half sleeves. They were not full sleeves, right? If you see, if you see the MBBS students and all of us during our student days, we wore half sleeves. Okay, later, of course, whatever it was, it became full sleeves, and
Was it a style statement? It became a full sleeve?
Yes, so.
I just want to know, I'm curious.
Well, it is said dress code, but let me tell you one thing, as doctors, I think doctors need to have a dress code. No, you can't be going with collarless T-shirts and jeans. No, the doctors need a dress code, right? Because remember, if you want your patients to have trust in you,
and if you want appropriately dressed,
exactly,
Can
you
I
have to
add
be.
to
There
that?
should be a dress code. But the issue is now the white coat was brought in as a dress code. Now, yes, a half sleeve white coat is perfectly fine as long as it is clean and neat. And nowadays in United Kingdom, what we are going is we're using scrubs these days. So when you come into the department, you change to scrubs, then you do your work, and then you leave the scrub, and then you go away.
I think that's
the point that has to be made. You see, for example, but unfortunately in India, we have the, you go to a little hotel and you find the waiters wearing a half white coat. So I just would like to reiterate that if it is meant to be a dress code for doctors, then it should actually whole good for doctors, like the lawyers have a code and they have their little tie. So in that case it would be so. Secondly, to maintain the sanctity of that white coat, you know, like someone mentioned, you wear this white coat and go all around town, and you wear you go to the
As a status
canteen and you
symbol.
go. So today, you know, you see white coats everywhere. I see it sometimes even at the petrol bunks. I see the ladies wearing white half sleeves and you know, pouring out petrol. So to a great extent I would prefer to choose some other form of a dress code in India rather than wear this half white coat, because for any,
Like for example,
you
has it been experimented elsewhere?
see, you know, if you're talking about safety,
What experiment in the sense?
Experimenting a new dress code, like if it is not a white full sleeve, if it is not a white half sleeve, then what else?
Well, as I said,
fashion's changing.
now it is scrubs, as I said.
Yeah.
So in United Kingdom, say I work in emergency department. I mean, we wear half scrubs. So you go into the department, okay. You take off your clothes, wear your scrubs.
A scrub is a full long.
You know, like, a scrub is like, you know, like the OT, the
Like
ones
the
what
OT
they wear
apparel.
in the operating
It's
theatres.
half sleeve, but it's, you know, a full length gown
That's
kind of
green.
thing.
Not
Here it is.
necessarily. You have pants
it's a
and
blue
halves.
top.
Okay.
It's
like
a
that.
blue top and something like a pajama.
Okay.
So you know, you wear it, and then while you finish your shift, and you put it in the laundry basket, and you come out. Yeah.
Okay.
I mean, that would be feasible
For a
in
surgeon
UK.
in UK.
Talking about our settings, I work for Bangalore Medical College and we have 5 hospitals attached. Let me give you 2 incidences. There was this one intern who was examining a patient without the apron, without the
apron.
the white coat. And then the next day the patient complained to the superior, the professor, saying no doctor came and looked at him at all. Because for him the identification of the intern was with the white coat. So that's the problem here, because that white coat, the sanctity, the purity.
Can you say that again? Look at this curious problem which occurred in a hospital where a doctor who was not appropriately dressed attended to a patient, and the patient complains
No,
to the
he was
superiors.
appropriately dressed, but not with the white coat.
Not with the white coat.
That's
Precisely,
it.
that's what I'm saying.
Yeah,
Not
that's
appropriately
what-
dressed in doctor's attire.
I say,
I
that would
Not appropriately dressed in doctor's attire.
yeah, appropriately dressed, yes,
He was
Bansi,
very
but not the white
appropriately dressed.
apron.
In the doctor's
Yeah.
attire. And he complained to the superiors that nobody had attended
Yes.
to him.
So
Now that's a serious risk.
That's a risk that we need to face in a setting where there are a lot of rural patients and all those who identify doctor with a white coat.
Almost everybody identifies a doctor with a stethoscope or a white coat or
So
some.
to change that mindset in India would take some time.
Okay, let's get Dr. Fernandes' response. Dr. Fernandes, how do you respond to this? You've proposed a ban on white coats. What about this problem that Dr. Banu has brought up?
Yeah, I mean, definitely that can be addressed, and it's just a matter of creating awareness. And an alternative could be to either provide a name badge or have a bow, so that the identification issue does not come up at all. And looking at it, common sense will tell you that a patient would go to the doctor in his chamber, and you won't find a doctor sitting in a patient's waiting lounge or in the outpatient department. Secondly, in some of the observations made by some of the senior colleagues there who've I've been a good admirer of, since 1947, what have we done to control hospital-acquired infections? Just because there is this article now published in the BMJ, which is a scientific review, people have started raising objections. Yes, instruments, stethoscopes also contain infections which get transmitted to the patients. But can we do something to reduce it? And white coat should be a feasible option. And unless the ministry intervenes, nothing is going to change. So through TV9, I would like to request the ministry to intervene and conduct a large-scale study with regard to the white coat and come up with a ban, at least with the long sleeves.
Yeah,
Fair enough.
not
Fair
only
enough.
that, you know, not only that, the whole thing is patient safety, like Dr. Fernandes said. Undoubtedly, from anecdotal evidence, the incidence of hospital infections are going up, more so in government hospitals throughout India. But again, I'm talking it from
So which
anecdote.
means the person is already has a problem He already carries an infection. He goes to the hospital, acquires a second problem.
Yes, exactly. You get worse. And the thing is,
You get worse.
but again, the reason, the thing is, one of the reasons is, say, it's not just one reason. Now, the whole hospital hygiene itself, right? The whole, the thing is, like, you have the environment, you have the instrument, and you have the doctor. Those are the three things. So, if we have to address hospital infections, we have to address all the three issues. We want to stop patients being harmed by a contaminated environment, be it beddings, linen, or the beds or anything. We want patients not to be harmed by contaminated instruments. We want patients not to be harmed by contaminated doctors. And white coat is one of the source of contamination.
Okay, doctor, I want to ask you, has this ban on white coats in the UK brought down the incidence of hospital related passing
Yes.
infection?
The answer is
we will take that answer after this very short break. Stay tuned. Welcome back. We're talking of the doctors. Should they stop wearing white long sleeved coats? This is the question. Now, doctor, in the UK you banned it.
Yeah.
It's more than 7 years since you banned it. Has there been a substantiative decrease in the hospital related infections passing around because of this?
Yes. See, let me tell you what happened in United Kingdom was prior to 2007, the incidence of hospital acquired infection went up. And then they said, okay, how to reduce the incidence of hospital related infections? And then they came up with 10 to 12 recommendations.
Okay.
Cleaning, hand hygiene, so many things. And one of them was that no doctor or nurse should wear a full sleeve. That's it. So you can wear a half sleeve or just below elbow. Okay. If you are wearing a sleeve shirt, make sure you fold it. So the thing is, after that code was introduced, there has been a definite significant reduction in the hospital related infections.
Okay, doctor, I want to ask you, if UK, which is considered like first world, has such a problem in the hospitals, now let's look at our hospitals. Let's say Vani Villas, you're part of the BMC. Let's say Vani Villas, let's say Victoria, let's say these are like hospitals where normal people dread to go.
No, I think that has changed and we have come a long way. The incidence of infections in our hospital is pretty less. All our patients, almost, most of them at least, go home hale and healthy.
I would like to differ there.
There's
I
doctor.
definitely would like to differ there.
Okay.
Let's not let's not dream and let's not sit very comfortably saying that you walk into Victoria, walk into Bowring, why not? Let's take a look, how do we restrict visitors? The number of, we're talking here about white coats, half-sleeved white coats. Yes, that is a tip of an iceberg which can be dealt with. But MRSA is not purely, one of the things you could avoid in a country like India. But whereas in UK, they have a lot more hygiene, lot more standardizations. You have, swabs taken from the walls, maybe I believe, of the hospital wards and things like that routinely. But here, the people who bring in food into the hospital, the people who touch one patient to another, let's talk about the state of our toilets. I would really like to know what is the state of toilets in Victoria and Bowring.
Someone goes and doesn't faint.
No, absolutely. It's not washed, it's not cleaned. And if it is cleaned, it would be done one session. Now let's get to the ayahs who clean the wards. What about their clothes? What about we've seen them mopping and so on and so forth, and the same ayahs come and pick up the patients also. So we are not streamlined in many areas. We have fantastic locations of hospitals. We have hospitals well built, ventilated like those ancient times. But I would beg to differ that
Hospital-related
hospital
infections.
hygiene, the patients coming in, the state of the bed sheets, of course they're much better. I won't say theatre is as bad and so on, but like Dr. Patil said, you know, I would suggest that, yeah, to identify a doctor in the corridor or in the outpatient, it is worthwhile that he wears a half-sleeved white shirt and white coat and sits where he sits. But once the doctor enters the ward for whatever rounds he is, because the doctor is not going to enter purely a non-infectious ward, most of all a surgeon, you understand. That is a place where he'll have to have his scrubs and he'll have to have his feet, you know, with those disposable things put inside. And like Dr. Savio mentioned, how many times are these white aprons washed? You know, if you should take a look, you should take a look at the armpit of the white apron.
That's a critical question. All of us wash our clothes, wear washed clothes almost every day. But how many times are these aprons washed? Now, this is a critical question, which takes us back to Dr. Fernandes. Yes, doctor.
Let's put it straight. I have 2 points to make. In the US, in spite of maintaining the optimum level of hygienes, 99,000 deaths occur due to hospital-acquired infections.
Okay.
$10 billion is the financial burden taking place, and 1.7 million people are infected with HAIs. Now, the state of affair in healthcare in India, I leave it to anybody to guess. And especially government hospitals, which many times are cockroach infested areas. This is not my statement. This was published in the Week many years ago, where they had said India's sham medical colleges and the state of affairs.
Okay.
Another point I want to make here is by 2030, India is going to lead the world in road traffic injuries.
Okay.
By 2025, India is going to be the diabetic capital in the world.
Okay.
World Health Organization has already branded India as the most depressed country in the world. Malnutrition, 194 billion is your number. Sorry, million is your number. And can we not do even little bit to take action on the white coat, which would save a significant amount of lives of our countrymen? I request enlightened administrators and enlightened doctors all around to not give knee-jerk reactions, but to sit back, introspect and think. The studies are straight on record.
Yeah, the thing is,
each fact is a slap on our faces, Indians.
no.
Each one of those
we are
facts.
talking about hospital-related infections here.
and not
This is
about India being the
thing
diabetes
is,
capital.
the role of white coat came in because we want to reduce harm to the patients. So the thing is, yes, if white coat is going to be a harm to the patients, you ban it. But the whole big issue is we are missing the bigger picture, which is hospital-related infections. And let me tell you one point very straight away. United Kingdom didn't do any special rocket science. They didn't bring any special equipment to reduce those infections. All it requires is simple hygiene. You just clean the hospital, you clean yourself and clean the instruments. Just do those things, that's all. There is no special equipment which is brought in to reduce the hospital infections. Clean environment, clean instruments, clean doctor. And let me tell you, give you a good example. If you ever visit the burns ward in Boring Hospital,
In Victoria.
in
Absolutely.
burns
Absolutely.
ward, yes,
Burns ward in Bowring
ward,
Hospital.
I'll tell you, there is a higher chance of a victim surviving if he is treated in his house rather than being treated in a burns ward. If you go to a burns ward, I'll tell you, my God, it's horrible. It's absolutely horrible. It is shameful that a city, a world-class software city in Bangalore has got such a dirty, filthy burns ward.
When have you seen this last?
Okay. So this is something which is alarming. Let's look at it and hear it again. On the one hand, Dr. Fernandes saying that by 2025 we are going to have among the highest incidence of diabetes in the world, which means where do the diabetics go? They go to a doctor, they go to a hospital. Is there a greater chance that the person is infected in the hospital once he goes there, in addition to his existing problem of diabetes? That is on the one hand. On the other, Dr. Neeraj Patil saying that the burns ward in Bowring, I have been to Victoria, is painful for anyone.
There is no burns ward in Bowring Hospital.
What's
there
that?
is only a burns ward in Victoria
Victoria,
Hospital.
sorry, I've got confused. It's Victoria.
Okay, I've been to the
Victoria
burns
Hospital.
ward in Victoria. I've been to the
Victoria.
burns ward. Dr. Patil can be excused because he's not from here. He's from
Yeah,
the UK.
it's Victoria.
Yeah, Victoria and Bowring, fine. So, if you have ever been to the burns ward in Victoria, well, the statement that you made, it's very, very painful, and Dr. Patil says it's better for the patient to be treated at home than in the burns ward. Why do you say so? Why do you say so? Then we'll take Dr.
You
Patil.
missed a point, Bansi.
Why do you say so?
See, the thing is, as no, we are talking about hospital-related infections. No. Let me tell you.
Road traffic accident. He brought a valid point to place. Forget the diabetic and the depression. Why he mentioned road traffic accident is that is where the surface area of injury is going to be very, very large. And when such patients are brought in for emergency management, and that is a point and a source of infection, because they take a long while to heal with dressing and so on and so forth. So the road traffic incident point, which Dr. Fernandes mentioned, by 2013 2030, I'm not sure what was it. 30 has a lot of credibility, because we are looking at an open surface area and large amounts of surface area.
Can
which
we
can
call
get
this
infected.
an unexplored area? Hospital,
No.
Hospital-acquired infection.
See,
Hospital-acquired infection is
as I
not
said,
an explored area.
hospital-acquired
By
infection.
and large, for the people of India.
It's
Yes,
not.
the
They
thing
are
is,
not aware of it.
what we call it as nosocomial infections.
Nosocomial.
So
Nosocomial
nosocomial infections. Now the thing is, these are infections. Now the thing is that the common bugs are, as I said, the MRSA, the C. difficile, the Pseudomonas. Okay, there are other bugs as well.
In addition to the medical names, can you speak about the symptom part of it, so people will relate?
Okay, the symptom part of it, let me tell you. Now it's very, very simple. Now, if you go to a hospital, now you undergo an operation. Now, what happens is, normally the wound should heal in 1 or 2 weeks. But unfortunately, what happens is, in the hospital environment, you have some very, very resistant bacteria that reside in the hospital itself. They're very, very resistant. One of the bug is called as a methicillin resistant staphylococcus. And then, now if you get infected with that MRSA, then the wound that should heal in 2 weeks may take 6 months to heal, may not heal at all. You may develop sepsis and die.
Can I talk on that?
Okay. Yeah. The second part, the others, that is one of them.
That's one way. The other one is what is called it as a C. difficile infection, which is C. difficile. Now, the thing is, a C. difficile is you get diarrheal illness. You get diarrheal illness and die, and it's very easily contaminated, especially with fomites, like teacups, spoons, trays and everything. And elderly people, if they get C. difficile infection, they quickly get dehydrated, and again there is a risk of death.
So in addition to the ban on white coats, we need to ban a few more things.
Yeah, there's lot needs to be done.
Like uncleanness from hospital needs to be banned.
Yes.
Yeah, Dr. Banu, you are from the Bangalore Medical College, which is like the
We appreciate Dr. Banu's position in this situation.
Correct,
She's not
absolutely.
at all in an easy position,
Absolutely.
okay, because she
But-
doesn't control it.
Absolutely.
But the fact is, she doesn't have all controls.
No,
but
let's
despite
talk about
that,
it. Let me listen.
we would like her to be upfront and honest,
Let
because
me talk
we
about
need
it.
to have
Let me
changes
talk
coming.
about it.
Okay?
I have 5 hospitals to defend or talk about. I'm not defending.
Okay.
I mean, why
To
is
speak
Victoria
about.
and Bowring being brought in? First of all, once it is brought in, I would like to say we
I'll
are
tell you why it is brought in.
3,000 beds, 3,000 beds, 1,000 OPDs per day easily, around 30 to 40 surgeries per day with minimum staff and minimum doctors. We are handling it. And I don't say we don't have hospital-acquired infections. Now let me define hospital-acquired infections for you. These are any infections a patient acquires in a hospital after 48 hours of admission. Now hospital-acquired infections are as common in a private sector as in a government sector.
It has all to do with carelessness.
No, there is a lot of factors to it. There is environmental factor, there are doctors, there are personnel involved, there is cleanliness, instruments. There are so many things here. Hospitals in our hospitals also are being cleaned thrice a day. But then see the crowd which comes to our hospitals in the elite group. Our hospitals cater to the poorest of the poor, the neediest of the needy, the destitutes. Police people come and dump people on us who nobody takes care, but we look after. In spite of that, we are trying to do a good job. My hospital infection is just 4%, and this is documented, published, cited by Fernandes.
Hold on to that thought.
It is
Dr.
cited
Banu
by
saying
Fernandes.
Hospital infections at these great Victoria and other hospitals of the
Which is
government are
very
just 4%. We slip into a short break on that. Welcome back. We're talking of this dreadful area of doctors passing on infections to their patients instead of curing them. And if you ask Dr. Banu, she says the incidence of hospital-acquired infections in the hospitals like Victoria and some of these hospitals around there are just 4%.
Yes.
Dr. Banu, can you explain
This
that?
is a study done and it's
Okay.
already published
Okay.
and accepted. We have in our hospital, let me tell you how this was
Okay,
achieved.
let's look at the 4% of infections. What infections have been passed on to the patients?
Usually in catheterized patients, we see urinary tract infections.
Okay.
Okay, and sometimes respiratory infections. Surgical site infections are not so much in our hospital. It could just be shocking to you,
Okay.
but we don't have so many SSIs. Major problem is respiratory infections and urinary tract infections.
Okay.
Diarrhea, as he said, it's not so rampant in our Indian settings at all. Most of the patients don't come with diarrhea at all as a nosocomial infection, but UTI and respiratory infections is a common problem for us. And MRSA, there is hospital-acquired MRSA and community-acquired MRSA also.
Okay. So here is a new line, line. There is a hospital that infects the patients. Also, there is the community role in this.
Yes.
So tell us about this.
MRSA colonizers could not only be in the hospital, the healthcare professionals or the doctors or people working in the hospitals, but there are so many civilians, the common people who could be colonized with MRSA, which is called the community-acquired methicillin-resistant Staphylococcus aureus. So not necessary that all the MRSA infections that a person is getting could be because of the hospital per se. And MRSA could infect even a common acne, which is the commonest organism, Staphylococcus aureus. It could be MRSA. It could be a common boil, a follicle, which would be MRSA. Any own road traffic accident which has happened somewhere, not in the hospital, could be infected by a methicillin-resistant organism which is there in the community. It's not that always MRSA is being given by the hospital to the patients. It could be the community itself which is having these bugs. It's there in the environment. It could survive on the clothing for 10 to 98 days. It's so sturdy, this organism. So we are talking about a dreaded bug which is there in all the environments. So
Taking
it's
her
not-
point,
So
10 to
is
98 days
Yeah.
when she speaks about
Yes.
it, that brings us back to the apron. If it is hanging around the apron for 10 to 98 days,
It's surviving.
then what should, it's survival. Then what would be the methodology of having it not on the apron, and what will the hospital do to sterilize it? Will they treat the aprons just as they treat the surgical gowns? Okay. And if it is so, it is a fact that none of the aprons are washed every day. Okay,
It's a
so
fact.
it's a fact.
And let
It's
me
a
tell you,
fact.
It's a fact.
Yeah,
Is it
a fact?
Let's
No,
say
no.
it more
It
than
depends
80%.
on
Is it a fact?
Is it a-
90%.
it's a fact.
I just want to, is it a fact?
It's a
Yes.
fact.
Aprons are not
70 to
washed.
It's a fact. You will
80%
find
not
them
washed.
hanging in the outpatient of most of the hospitals. They
washed
come in
once
the
a week.
morning and pick it up. Okay, so you don't find a neatly sterilized apron brought to the doctor when he enters the outpatient, right?
Unless the apron is a disposable kind of apron, like
But
But
paper
then
apron.
if you are
which is
then you'll have
thrown
disposing,
far
you are
too
creating
much.
more of biomedical waste, which will again be a problem for you, which adds to the hospital-acquired infections.
So the
Because
most important thing is wash it. every day.
wash it or use a fresh apron every day,
But
which
most
is washed.
aprons are
Will
not
washing
washed
kill
every
the
day.
bug?
Yes, it will.
let
Will
me
washing kill the bug?
Yes,
let me
it does.
intervene.
Yeah.
So let me tell you one of the things. I'll tell you very honestly. Most of the hospitals in India they don't keep a record of hospital related infections. We don't have any incidents. No, unfortunately, we don't have the count. We don't have the count. We don't know the exact incidence of hospital related infections.
So it's a grey area really.
It's a grey area, and this is just a guess.
None of the
Now
hospital
the thing
wants
is,
to say its own infection.
so now the thing
Whistleblower.
is,
So then
one of
the
the things
4%
what
is the
United
question
Kingdom
on
does
the
is,
Dr.
let me
Banu.
tell
That,
you,
ma'am.
let me tell you.
Coming from Dr. Banu, then the fourth person is in a grey area. When she says
No,
one
let
of
me-
the
let me
hospital
complete what-
records it,
Study.
4% is grey.
Yeah.
No, let me complete
That
what
is
I'm
my
saying.
hospital.
Okay.
I have done that study and I'm bold enough to say we have that much infection.
You have done this.
Yes, we have done this
So
study.
no. Let me add something. What happens is, see, the thing is, say take for instance, her hospital, the incidence is 4%. Now say if his hospital, the incidence is 10%. Then what happens is, okay, right? Somebody, a team from the above, from the health ministry, goes and says, fine, there is something you guys are doing wrong. So they come up with a recommendation. That's what happens in UK. And let me tell you, with this MRSA, as the thing is, the problem of MRSA comes is, I may be carrying MRSA. You may be carrying MRSA. It's not a problem. The problem occurs when the MRSA infects a vulnerable individual. When I mean a vulnerable individual, somebody who is immunocompromised, somebody who has underwent a recent operation, somebody who is old and frail. Only when these people get infected, then it's a problem. And let me tell you, the environment plays a very, very important role in spreading infection. And I can tell you, the burns ward in all the government hospitals throughout the India are in absolute shambles. And I'll tell you, it is appalling to see the burns wards across all the metropolitan
major
hospitals
hospitals.
and district hospitals. I mean, and the thing is, this is something which the health ministry needs to address.
Yeah, let me.
If this is not shocked you, please hold on. We slip into a short break.
Can we stick on to
Welcome back. We're talking of this dreadful issue of hospital-acquired infections, and one doctor from Mangalore suggesting that the white coat should be banned. Now let's speak to the doctor himself, Dr. Fernandes. Yes, doctor.
Can I come in? Yes. Adding to what Dr. Banu just said, that the infection and the bacteria are also found in communities and not necessarily in hospitals. The point I'm trying to raise here is, does it ethically permit doctors, after knowing that hospital-acquired infections exist, to continue carrying on the same? And with regard to compliance, hand washing, hygiene, I've quoted in my review article number 12, which was a study done in an intensive care unit in northern India. And that study found that more than 75% of the doctors don't wash their hands inside an ICU, in spite of knowing the fact that it's needed to be a hygienic setup. And the reasons they give is the volume game, the number of patients they have to see, and the time constraint that they face.
Okay.
This showcases to a matter of fact that unless there is a radical decision taken by the ministry, we are not going to, we may just appreciate, agree with each other, disagree with each other on a professional debate, but we are not going to take it forward from here.
But we totally agree with the lab coats or aprons being half-sleeved. I think that should be a regulation, and there should be restriction on where it is worn. And the third thing is, who wears it? Only doctors wear
I
it, and
think
not
that
all
should be
Tom,
fine.
Dick and Harry, anybody, a caterer, a supplier doesn't wear a
Petrol
white
bunk
coat.
attendant.
Everybody,
Even the
petrol
nurses
pen.
wear it. You go to the laboratory, you have the lab technician wearing a half-sleeved white coat.
Everybody
You have the
wears it.
nurses wearing a, because the nurses now have a different color of uniform.
You also have the barber, and people
the
like you
person who
mentioned in the
supplies
notice
tea
wearing
in
the
the
white
trains.
coat.
It is
Everybody
appalling.
wears it.
It's appalling, you know,
Which
to
is-
have
which is
that.
very
Well,
disgusting.
the thing is, I
So
disagree.
the argument, if some people are trying to make that instruments, stethoscopes also contain infection, let's at least start with the white coat and then make progress from there. Why are we change resistant? Don't we care enough for the people of the country?
See, let me tell you something. You cannot ban anybody from wearing a white coat. Let me tell you, because this is people's freedom. Okay. Now, you cannot. So anybody.
But then you can't enforce people to wear it either.
People at petrol stations wear white coats. Barbers wear white coats. People in various chefs wear white coats. The thing is,
attendants
Yes.
the thing is, you can't bring a legislation. You can't bring a legislation in the parliament saying that, okay, white coats are exclusively for doctors. You can't wear them, just like the police uniforms, like that. It's not practical. Yes, the thing is, it's the duty of the doctor also to give that special confidence that he can be trusted. So the thing is, yes, banning white coat is not the solution. Yes, making it half sleeves is a solution. Yes, banning stethoscope is not a solution. Yes, making sure you clean the stethoscope. You have to sterilize the stethoscope at least once a day after examination. So just like you sterilize instruments, that is the way forward.
After every use?
Not after every
how
use. You
many of
can't
them
do
are going
it
to
practical
follow
to
that
do
Why
it for
then
every
do you
use.
require a
But
white coat?
the thing is, ideally speaking, they say in UK, everyone says, okay, how frequently you should wash your hands. They say after examining every
Each
single
patient.
patient. But let me tell you, it is not practical.
It's not feasible.
It's not feasible. So at least after examining 4 or 5 patients, you wash your hands. Or if you're doing an invasive procedure, very important. See, if I'm just examining someone, that's not an issue. If I'm suturing a wound, if I'm doing an operation, or if I am seeing a vulnerable patient who's immunocompromised, yes, I have to make it a point to wash my hands. Not only wash my hands, there is a special gel which you have to apply. Only when you apply that special gel, you're going to kill all the bugs.
Yeah, Dr. Savio, you've been waiting to make a point.
Yeah, this is basically, it's not about the white coat, it's multifactorial, what Dr. Banu said. Every hospital should maintain, and there's an accreditation procedures are there, National Board of Hospitals, to accredit quality control. Now, one of the quality controls is infection rates in the hospitals. In that, there will be an upper limit. Usually there is an international standard of what is the acceptable hospital infection rate for each of the various diseases.
What is the required, what is the present rate?
No, I don't have the,
Those
those
are
are
guidelines
specific for each
infection.
thing, like surgical site infections, respiratory infections, urinary tract infections. So these happen because ideally a patient should be there only for 3 or 4 days in the hospital. So the longer he stays in the hospital, he is prone to get infection from fellow patients as well as from various the environment within the hospital. So it is the hospital has to have quality protocols, processes, and quality control methods by which cleanliness and patient safety is maintained in the hospital. Sterile areas which are in the operation theatre, those should be kept sterile, and you have to monitor presence of infection in those areas. Areas which are meant to be clean have to be kept clean, they have to be washed. So we have to differentiate between sterile areas, clean areas, patient areas, entry points, and it's a multifactorial thing. Just banning the lab coat is not the solution. Madras High Court has passed an order saying that doctors, when they come to give witness in the any of the courts in Tamil Nadu, they have to wear a white lab coat and go. Now when they have to give witnesses, and it's a statutory requirement to step into the court. Lawyers will wear their black devil's advocate coats whereas doctors will have to wear their angel's dress. So that is the only difference. The issue is not about banning the coats. Only thing is there should be awareness. Once there is an infection, it has to be kept within a lower control limit and an upper control limit. Within the range, acceptable range, the infection has to. If it goes beyond that range, then you have to take preventive and corrective mechanism, and you have to identify what is the source of that infection. Why is it going beyond the acceptable range which the international community is telling? So it's an academic process, and for a quality process, is not cheap. It takes 5% of the budget has to be allocated only for quality control processes.
Let me add here, since we are talking about my hospitals, let me tell you it's a good news that all of us have gone in for application for accreditation. We have applied for NABH, SAFI. This is about the infection control aspect. So all the 5 hospitals have applied. We have a pre-assessment in August, and shortly I can assure you that 4% that I was talking about, we will see that it comes below 1%. I mean, that confidence I have in our
I hope
hospitals.
it's an honest 1%.
Oh, of course, you could come and audit, because accreditation process you could ask, they come and they're very strict with us.
Because in the UK if it is so high.
Well, I would hold the Dr. Bhanu on
Yeah,
that.
Dr.
I'm going
Bhanu.
to visit their burns ward
Yes.
next year. Next year, I'm going to visit the burns ward in Victoria.
Yes.
And you are the witness, people are the witness,
To
and
see
the
if
whole
there is
Karnataka
anything.
is a witness. Let's
If
see,
there
let's
is a
see.
positive change, of course he can
I
come
have
and
my
do
own
that.
doubts. Honestly,
No.
I have my own doubts. So let's,
No,
okay,
the
fine, I'll give you the
accreditation-
benefit
no,
of
I'll
doubt.
tell you, the accreditation board is not so easy. The NABH is very strict. If he could tell you,
Okay,
they
no,
go
no,
into
finally,
strict quality.
Finally.
So if it happens with the good of all the patients. And I'm sure I want that challenge to be taken up by my
Surely,
colleagues
surely.
and my group.
We would like that challenge to be
Oh
taken
yes,
up.
Taken
yes.
up
The
by
thing
us.
is, I'll tell you, I would be the happiest man if I am proved wrong that the burns ward next year in Victoria Hospital
Has
is
improved.
clean, neat and tidy.
I-
Oh yes,
I
I would be absolutely,
get
and
accredited.
I am confident that I will be correct.
Okay.
let's
Now
wait.
before we wrap, we have the last few little less than a minute. Now before we wrap, how many of you think white coat should be banned? Dr. Fernandes, how many of you think white coat should be banned? Can you put up your hands? Okay, there's only one hand going up. There's a second hand here. Dr. Reena Sunil saying white coat should be
It
banned.
needs correction. It needs correction.
Okay. Yes, Dr. Fernandes.
And just adding to what Dr. Bhanu said, 3 years ago in the Hindu editorial,
Okay.
there was an article written where they said, for more fiction, please visit statistics site of the Ministry of Health.
For more
I repeat,
fiction,
for more fiction, please visit the statistics site of the Ministry of Health.
for more fiction, visit the statistical site of the Ministry of Health.
I'm
Does that
talking-
also include
Dr. Fernandes,
BMC?
I'm talking about accreditation process, and that can't be fiction, and that will be a reality, and it's strict quality control, and we are going in for that to prove what we say,
wait for
and I
that day
hope
on
we
Whisper
prove what we say
Idealism.
after a year.
Oh, well, Burns ward is not a fiction, it's a reality. As we speak today, we can go to the Burns ward now at this very moment to Victoria Hospital. It's not
But
fiction.
I'm sure the full sleeves apron are not going to cause the infection in the burns ward. It's not the aprons that are causing a white coats. There are multiple factors working there.
Else. Okay.
So we
But
do.
I would conclude saying that you don't require a white coat to prove that you're a doctor. The attitude of the person behind the desk when the outpatient walks in, he knows that he is dealing with a doctor when the doctor deals with him. Secondly, one extra clothing on the body can be removed, and that much more infection can be prevented. Thirdly, when you're wearing your own daily clothes, it is ensured that it is washed and fresh every day. Fourthly, these coats hanging around these places, and none of us go and imitate the lawyers and their clothing, so if we do definitely need to have something which says that we are a doctor, then we could have name tags and mentioning that we are
Doctor,
doctors
name,
and what
designation.
is the position and designation. That's all what is required.
That's enough. Okay.
You don't need more
with
than that.
With that, we come to the end of this debate. Should we ban white coats or not? Only 2 doctors out of 5 saying yes, we need to ban them. but the problem is much bigger than just banning white coats. The problem is a spectrum really. It's not just the white coat to blame for the hospital-acquired infections. Unless the authorities wake up, people will continue to suffer with that. It's a wrap. On the other side is a news bulletin. Stay tuned.